Hello guys, welcome back to my YouTube channel InfoBro. So in this video, it will be about coagulase test. So the coagulase test, it is the most commonly used biochemical reaction and it is used for the identification of the Streptococcus aureus. So it is the most commonly used biochemical reaction and it is used for the identification of the Streptococcus aureus. So it is of two types. The first one is the tube coagulase test and second one is the slide coagulase test. So the first one, tube coagulase test, as of course it is take place in the test tube. The name itself showing that it is taking place in the test tube. So it detects free coagulase secreted by the Streptococcus aureus. So it detects the presence of the Streptococcus aureus or identify the Streptococcus aureus by detecting the free coagulase that present in the test tube. And the procedure is by the colony of the Streptococcus aureus is emulsified in 1 ml of diluted plasma, that is 1:6, in a test tube and incubated at 37 degrees Celsius. And the colony is emulsified in 1 ml of diluted plasma 1:6, that in a test tube and incubated at 37 degrees Celsius. And this is the procedure for the tube coagulase test. And second, the positive test. So it gives a positive and a negative test. So the positive test is by the formation of the clot that does not flow when the test tube is tilted. So there will be a formation of clot and it will not flow when the test tube is tilted. And this is the positive test that show positive result shown in the tube coagulase test. So in the negative tube, it should be incubated overnight and re-examined as some strain may produce delayed clot. In negative tube, it should be incubated overnight. So some shows the negative result. So it should be incubated overnight and re-examined as some strain may produce delayed clot. And false positive, sometimes it produces a false positive, but it is not Streptococcus aureus but shows the positive clotting. So it is due to the citrated plasma. The citrated plasma should not be used because some bacteria may utilize citrate and give false positive test. So the citrated plasma gives the false positive test. Now for the slide coagulase test. So the slide coagulase test, it detects the clumping factor, that is bound coagulase. In previous one, it is free coagulase. In slide coagulase test, it is bound coagulase. It detects the bound coagulase. And the procedure include a colony is emulsified with a drop of normal saline on a clean slide to form the milky white suspension. So the colony is emulsified with a drop of normal saline on a clean slide to form the milky white suspension. Then a loop full of undiluted plasma is added and mixed properly. Then a loop full of undiluted plasma is added and mixed properly. And the positive result is indicated by the formation of coarse clumps. So the positive result is indicated by the coarse clumps. And that's for the slide coagulase test. If you like this video, hit the like button and subscribe my channel for future videos. Thank you.